let us start. Our first speaker is Dr. Yasser Fadden. And Dr. Yasser, mashallah, he is the chair of the Department of Obstetrics and Gynecology, King Saud bin Abdulaziz University in Riyadh. Professor Yasser has 3 fellowships, but his main area of interest is actually fetal medicine. And from his perspective for fetal medicine, he's going to enlighten us today about vaccination and important updates in vaccination during a pregnancy. And I would like to leave the podium now for Professor Yasser to continue with his subject. Dr. Yasser, it's your time.
Thank you very much, Professor Shamsa, for your kind introduction. Can you see my screen?
Yes, we can.
Yes.
All right. So thank you once again, Professor Shamsa, for your kind introduction. And I would also like to thank Habdan bin Rashid Al Maktoum Foundation for Medical and Educational Sciences for inviting me to be with you this evening to present this very important topic to ensure the safety of our mothers and also of the unborn fetuses and also the newborns. So I'm going to be talking about vaccination in pregnancy and the protective roles of maternal immunization in the early life of our neonates. So probably to start off, we need to talk about what are the burdens of these different vaccine preventable diseases. And I'm going to be focusing on 3 diseases. First of all, the flu or influenza, and also pertussis and COVID-19. So let's first of all talk about the burden of influenza, both in pregnant women and also in the young infants. So if we're going to talk about the flu or the influenza, as we all know, it is a contagious respiratory illness that's caused by the influenza viruses, mainly type A and type B. The disease can be anywhere from mild to severe illness, and it affects all age groups. And sometimes there can be serious complications, and sometimes it can lead to death. So it shouldn't be taken lightly. The flu symptoms, as we all know, includes fever, cough, sore throat, runny nose, muscle pain, headaches, fatigue, and general discomfort. Some people are at the risk of having severe or serious complications such as pneumonia or cardiovascular events, stroke, or even abnormal metabolic changes. Influenza infection can also worsen other conditions that the patient might have, such as those who have asthma or chronic heart disease, diabetes, and also they increase the risk of complications during pregnancy. So pregnant women and their young infants are considered among those at the greatest risk of developing serious complications of influenza. So how does it affect pregnant women, the unborn child, and the newborn child? So for pregnant women, influenza has been shown to increase morbidity. It increases hospitalization in pregnant women as compared to non-pregnant women. It also increases the risk of death. How about fetuses? For fetuses, it increases the risk of fetal growth restriction, fetal distress, fetal mortality, increases the risk of the woman going into preterm delivery and ending up with a premature baby, increases the risk of cesarean delivery. For the newborn baby, increases the risk of having a low birth weight infant, increases the risk of being admitted to the neonatal ICU, increases the risk of neonatal death, increases the risk for hospital admissions for the infant. So pregnant women are more than 2 times more likely to be admitted to the hospital with influenza than non-pregnant women, as can be seen here in this meta-analysis graph, where the odds ratio is almost 2.5. And this was based on a review of 152 observational studies. Now, how about infants? And specifically talking about those who are less than 6 months of age. Again, they are most likely to need hospitalization or die from complications of influenza. So the bar graph you can see on the left-hand side of the screen, this shows you that the age group of less than 6 months, as you can see across the different age groups, and in each year for a period of 9 years, in this study showed that the most to be hospitalized were those in the age group of less than 6 months. Also, on the right-hand side, we can see that the mortality was also most significant in this age group, being which is less than 6 months of age, and then it significantly dropped after 2 years of age. So again, just to demonstrate, how these infants who are aged less than 6 months are higher at risk of needing hospitalization, and also higher risk of mortality. So we talked about the burden of influenza. Now let's talk about the burden of pertussis in young infants. So again, what is pertussis? Pertussis is known also as whooping cough. And I do recommend that later on you go and open the YouTube and just search whooping cough and listen to those infants or children who have whooping cough. I mean, it's something that makes you really sad to see children suffering from this disease. Again, it's a highly contagious infection that affects the airways and lungs, and it's caused by a bacteria, Bordetella pertussis. And usually the symptoms include persistent, uncontrollable, violent coughing. And this coughing causes breathing difficulties. And pertussis, it needs these children or the people who are affected with pertussis, they actually need to take deep breaths, and this is what results in the whooping sound. And therefore, it's called the whooping cough. So again, pertussis can affect any age group, but it is considered most serious and even fatal in those infants who are under 1 year of age. And despite of vaccination, even today, pertussis still remains one of the most poorly controlled vaccine-preventable diseases, unfortunately. So this again shows across all age groups that the highest number of pertussis cases occurs in infants who are aged less than 1 year of age, as you can see here, which is the line, the upper line on the left-hand side of the screen. And on the right-hand side of the screen, we can see the pertussis notification rate in European countries. So pertussis, as we said, can be life-threatening in infants. About 1/3 of infants with pertussis, they're going to require treatment in the hospital. And 1% of those babies who receive treatment, they do not survive. And this 1% is considered a significant number. The complications that are most likely to happen in these infants include respiratory complications like apnea, pneumonia. Also, there are neurological complications like seizures, encephalopathy. Pneumothorax can also occur, subdural hematoma. Pneumonia occurs in about 22% of those infants who are hospitalized. Compare that with only a 2% rate of hospitalized adults, so significant difference. Encephalopathy is uncommon, but is considered a serious complication also of pertussis and occurs in about less than 1% of hospitalized infants. So the younger the infant is, the greater the risk of severe pertussis disease, and the greater the risk of death. So again, here this shows the data from an Argentina study that showed the high incidence of pertussis during the first 4 to 5 months of an infant's life, and showing the decline after 6 months of age. So how about the burden of COVID-19 in pregnant women? So again, in pregnant women, as we can see here, when we're going to compare them with non-pregnant women with COVID-19, pregnant women were more likely to require ICU admission. They were more likely to require invasive ventilation, or ECMO. ECMO stands for extracorporeal membranous oxygenation, and also had a higher mortality rate. So why do we need to provide immunization or vaccination for our pregnant women? And this is what we're going to be talking about now, the rationale for vaccination to protect our pregnant patients and their young infants. And before we talk about that, let's talk about the considerations that we need to account for when developing vaccines. So when vaccines are developed, we need to make sure that these vaccines are safe to our pregnant patients and their fetuses. We need to make sure that the vaccines are immunogenic, so they elicit a good antibody response. And this antibody and antibodies are generated in pregnant women. We need to make sure that these antibodies are able to cross the placenta to the fetus and therefore provide protection to the fetus. We need to also make sure that the antibody levels are at a high enough concentration to provide lasting protection for the infant. And then we need to consider how the vaccines are going to be given in clinical practice. So we need to talk about or develop policies to mention things related to logistics and practicalities. Now, this is showing an example of an immunization program. So just to show you here the different vaccines that are usually given to infants or children or later adolescents and adults. So we can see here for pertussis, vaccines are only given to these infants after 2 months of age. Influenza, even later than that, until 6 months. So this period, the first 2 months, there's lack of any early immunization. And the reason for that, why don't we give immunization once the baby is born, is because it doesn't have any effect, the vaccines, the first 2 months of age. But it's actually the first 6 months of age of an infant which is considered the window of vulnerability, and they can develop infections and develop the serious complications we mentioned earlier. This is just showing you our immunization card for infants and children in Saudi Arabia. So again, they don't receive the pertussis vaccine till after 2 months of age. So again, there's lack of early immunization. Again, the window of vulnerability is the first 6 months of age. And this is in the Emirates. So this is showing you the immunizations schedule taken by the health authority in Abu Dhabi. So showing you again, pertussis vaccine isn't given until after 2 months of age. And also there's a lack of early immunization. And the window of vulnerability is the same for the first 6 months of age of the infant. So vaccination is important, and it aims to increase the infant's antibody levels above that is needed for immunity. And this is the ideal vaccine that we want. We need to create a maternal antibody concentration to above the level needed to provide immunity throughout pregnancy, and to increase and maintain the antibody concentration in newborns to a level that's needed to provide immunity until they start getting their primary series of immunizations. So according to guidelines, and I'm showing you an example of the US guidance with regards to recommendations for vaccines, you can see here that there are 3 vaccines that are recommended to be given in pregnant individuals: COVID-19, influenza, and Tdap for pertussis. So these are the 3 vaccines that we need to increase awareness amongst us as physicians and amongst our pregnant women. So let's talk now about the safety, the immunogenicity, safety, effectiveness of influenza vaccine in pregnancy. So because this is a main concern of our pregnant patients, they're always concerned about its safety. And this is the reason why they refuse to take the vaccine, because they are concerned that it's not safe, mainly for their fetuses, their unborn fetuses, and maybe unsafe for them. So we need to talk about safety of vaccination. Is it safe? So there's now an abundant data in the literature that confirms the safety profile of these different vaccines. And let's talk first about the influenza vaccine. Influenza vaccine, there hasn't been shown any increase in adverse birth outcomes like stillbirths or congenital abnormalities. And it showed actually slightly low risk of preterm birth or having a low birth weight baby. So this is with regards to systematic reviews regarding the influenza vaccine in pregnancy. Randomized trials also show that influenza vaccine in pregnancy helps to protect the pregnant individual and infant. So again here, showing the reduction in respiratory illness in pregnant individuals, so showing reduction in lab-confirmed influenza, and also studies showed how the efficacy of vaccine in pregnancy, high rates of efficacy, 50 to 70% of pregnant individuals, 30 to 50% in infants. So going on to influenza vaccine, fewer cases of severe pneumonia and hospitalization in infants. So again, we have abundant evidence regarding that from randomized trials. And we also have meta-analyses, which is considered the highest level of evidence that showed how influenza vaccine helps prevent influenza cases and also hospitalizations in infants less than 6 months of age. So showed 48% decrease in risk of influenza in infants, 72% decrease in the risk of hospitalization for influenza. So how about the immunogenicity, safety, and effectiveness of pertussis? So again, the same thing, good high-level evidence, systematic reviews, as we can see here, that confirms the immune response to pertussis vaccination during pregnancy. So Tdap vaccination has led to strong immune response in the mother. The vaccination resulted in high transfer of pertussis antibodies across the placenta to the infant. And vaccination during the second and early third trimester of pregnancy was considered the ideal time for transfer of antibodies. So again, here, this is a review of 16 studies from multiple countries, and it also showed safety in more than 150,000 vaccinated pregnancies. So the findings were consistent, and it showed that there was similar risks of safety outcomes in vaccinated and unvaccinated pregnancies. So according to these Tdap vaccine registries, it did not raise any specific safety concerns with respect to pregnancy and neonatal outcomes. So another review of 22 studies here over a 9-year period confirms the effectiveness of pertussis vaccination during pregnancy and protecting vulnerable infants too young to be vaccinated. So again, prevention of pertussis, very high rate, 69 to 91%. Prevention of pertussis-associated hospitalization, above 90%. Prevention of death due to pertussis, about 95%, so very high rate. Again, this is showing that the pertussis vaccination pregnancy was associated with reduced incidence of disease in infants also aged less than 2 months of age. So notice the decrease comparing the incidence rates of pertussis in the United States in the pre-vaccine period, which is 2000 to 2010, and in the post-vaccine period, 2012 to 2019. So notice a significant drop in the incidence rate of infants with pertussis. So again, this is just showing you a study that was conducted in Saudi Arabia regarding the awareness of the international and national recommendation of giving Tdap vaccination. So it showed that the awareness was low, unfortunately. So that's why our Ministry of Health, they had a campaign and they made some awareness events for both patients and physicians about the importance of pertussis vaccination. And then talking about the safety of and effectiveness of COVID-19 vaccination in pregnancy. Again, COVID-19 vaccination in pregnancy, there were no reports of increased risk for different outcomes like gestational diabetes, hypertension, cesarean delivery, preterm birth, abruption, low Apgar scores, or low birth weight. So again, confirming the safety of COVID-19 vaccination in pregnant individuals. It actually showed 45% reduction in stillbirth, 15% reduction, 15 to 33% reduction in preterm birth, depending on the gestational age. So again, it was also associated with 20% reduction in the risk of neonatal ICU admission. So again, COVID-19, influenza, Tdap vaccines are recommended by international guidelines to be given to pregnant women. And this is the reason why we are presenting this. So many guidelines have been developed, and this is showing you that our guidelines also in Saudi Arabia was changed, and we also recommend giving these vaccines during pregnancy to protect our unborn infants. So hopefully after this presentation, we would have more of you offering to give these vaccines to our pregnant mothers and to reduce the risk of infection in our neonates. Thank you very much.